Hello everyone, welcome again. It's your favorite Greek from Brooklyn, Dr. Chris Paris. And today I'm going to give you a little snippet on hypoxia. How to address hypoxia, real quick. We don't have time for obviously a lot of details. For that you have to come to my live class or live online class for that. But a little snippet to give you guys a simple understanding of what to do when someone's oxygen is low. So if you're dealing with hypoxia, right, a low oxygen, right, a low oxygen, hypoxia is a product of what? So when we oxygenate our blood, where does the oxygen come from? It comes from the atmosphere, right? It comes from the atmosphere. The tool that we use to determine whether the oxygen from the atmosphere is getting into our blood supply, who knows what the name of that tool is? It's a calculation that we use. That tool is called the AA gradient, right? It's called the AA gradient. The AA gradient. The big A being atmospheric oxygen, the little a being arterial oxygen, right? And it tells us whether the oxygen from the atmosphere is getting into our arterial blood supply. Very simple, right? Very simple concept. When you're dealing with hypoxia, the way you break down your differential diagnosis is whether your AA gradient is normal or it's not. Because if the AA gradient is not normal, meaning it's elevated, and a normal AA gradient is between 10 to 14, all right? If the AA gradient is elevated, that tells us what? That tells us that the oxygen from the atmosphere is not getting in. It's not passing go. The oxygen from the atmosphere is not getting in. So when you have an elevated AA gradient, the reason why this happens is something called a VQ mismatch. Remember that from physiology? The ventilation to perfusion mismatch. The lung is a very smart organ. It does not want to perfuse a part of itself which is not ventilating well. Why? Because it wants to optimize gas exchange. It wants to dump carbon dioxide and pull in oxygen, right? It's not stupid. It doesn't want to ventilate itself where it's not perfused, and it does not want to perfuse itself where it's not ventilated. It's very smart. It always wants to maintain the VQ ratio around 1. If the VQ ratio is not around 1, then you have what's called a mismatch, which leads to an AA gradient, which leads to hypoxia. Wow. See that? So VQ mismatch leads to an elevated AA gradient, which leads to hypoxia. Right? Now, little thing about the VQ ratio, right? If your V is equal to 0, if there is no ventilation to that part of the pulmonary segment, what's that called? Who remembers what's that called? When V is equal to 0. If V is equal to 0, it is called a shunt. This is a shunt. Right? Now what about if Q is equal to 0? What's that called? Q meaning, sorry for the noise, guys. We are actually, I just finished class in Washington, D.C. So I'm just doing this for you guys, but the class is a little rowdy. So if Q is equal to 0, what's that called? Q meaning perfusion for gas exchange, not to feed tissue, perfusion for gas exchange. If Q is 0, what's that called? That's called dead space. That's dead space. That's the trachea. That's the large bronchi, right? That's dead space. See that? Well, that's how you break it down. Hypoxic, you look at the AA gradient. If the AA gradient is elevated, then you have a VQ mismatch. If V is equal to 0, that's a shunt. If Q is equal to 0, that's dead space. Otherwise, you have a mismatch somewhere in between, whether it's a pulmonary embolus, whether it's an infection, whether it's an autoimmune disease, whatever the case may be. Simple enough, right? What if your AA gradient is normal? If it's normal, then what's your cause of your hypoxia? Well, the cause of the hypoxia then is not lung function, per se. It's not alveolar function, to be more specific. The alveoli are working fine because what the AA gradient and what the VQ ratio tell us is, are the alveoli working normally? And they are. In this case, they are. So if the alveoli are working normally, then where's the problem? The problem's on the outside, right? The muscles of the chest wall, the bones. This is neuromuscular disorders. Neuromuscular disorders, such as Guillain-Barré syndrome, right? Such as opiate toxicity. Why would opiates cause hypoxia with a normal AA gradient? Because they cause respiratory fatigue, respiratory paralysis, right? That's why they go. So it's not a VQ mismatch, but it's a muscular problem. So when you have a normal AA gradient with hypoxia, you have a muscular problem, whether it's neurologic or whether it's pharmacologic, right? And the telltale sign of a normal AA gradient hypoxia due to muscular problems, due to hypercapnia, this is hypercapnic respiratory failure, is an elevated, what? PCO2. That's the telltale sign. The carbon dioxide is elevated because these patients retain. All right, guys? Hope you enjoyed this short snippet. I'll see you guys soon. Find me. Be good. Love you guys. Peace.